Hi, my name is Amy, and you're watching Feminomics TV.
Confused about the new Affordable Care Act? Me too. There's a lot to take in, and there are differences depending on whether you get health insurance through work or have to buy it on your own. The good news is that the law broadens coverage for women and ends many pricing practices that worked against us. So hang tight as we test your knowledge with the Fem on the Street pop quiz, talk with an industry expert, and share resources to help you get going. All that and more, right here on Feminomics.
Feminomics has decided to hit the streets and speak with you, our fellow feministas, to see what you know, if anything, about the Affordable Care Act. Now, to do this, we've created our own pop quiz based on the work of the Kaiser Family Foundation. Now, the good thing is, you can't fail. Now, let's have some fun. True or false? Prior to the Affordable Care Act of 2010, 92% of the best-selling insurance plans regularly practice gender-based pricing, meaning higher costs for women. So you and I would get charged more money just because, we got, you know what I mean, on privately sold plans, okay? True or false?
True.
True, you are right. All the way from Boston. Which of the following is not included in the Affordable Care Act's coverage for women? A, maternity care. B, the HPV vaccination. C, co-payment coverage for birth control. D, daycare services, or E, mammogram screenings.
It would be D, daycare services.
You are good. You work in healthcare?
No, but my mom's an OBGYN.
Oh, okay. All right. Little cheating here. It's all right. Okay. True or false? Screening for gestational diabetes, that's a type of diabetes women have when they're pregnant, isn't covered under the Affordable Care Act preventative care changes. False. False. Screening is covered. Yes! High five for your mom. Scream. What racial ethnic group of women are least likely to be insured? A, Caucasian. B, African American. C, Asian. Or D, Latina. And you can ask your friend. You want to poll a friend? Huddle? African American? Is that your final answer? Final answer?
African American?
African American. It's Latino. And 30%, actually, here's the statistic. So 38% of Latinas are uninsured compared with 14% of Caucasian women and 23% of African American women. Good try, good job, good job. A key aspect of the Affordable Care Act, the health insurances, exchanges, are the brainchild of what former U.S. governor? A, Rick Perry. B, Andrew Cuomo. C, Chris Christie. Or D, Mitt Romney?
Mitt Romney.
Oh, that was easy. Now I get harder. Ding, 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 ding. What share of women between the ages of 18 and 64 are uninsured? A, 1 out of 5. B, 2 out of 3. Or C, 1 out of 6.
2 out of 3?
I got you! No. Finally! Right. So 1 out of 5 women are uninsured, unfortunately. 19 million women in 2011 are going without insurance.
Well, they're going to be insured now, hopefully.
Hopefully they'll have an option, or they'll get taxed. One or the other. All right. Thank you so much.
Women make the decisions about what health insurance to buy. Not that you're surprised. So Feminomics spoke with Ann Asbaty of Cigna to learn the essentials of how to shop for coverage and ways to make the most of it. Ann, I'd love to start off, if you don't mind, with an email that I got from a young woman named Kay, who says, "Hey Lisa, I'm having a really hard time trying to figure out what insurance to get. It's all confusing to me, and I was hoping you could help me out."
This time of year is one of decision. It can be one of confusion. And if you read the news right now, there's an awful lot going on healthcare and the Affordable Care Act. And one of the things that I always say when I talk to women is, you are the chief medical officer of your family. not only are you the chief medical officer of your family, you're the chief financial officer of your family. And those are two very important positions, and they come with an awful lot of responsibility.
Ann explained key terms we need to know when shopping for health insurance.
And as you go to make a determination of which plan has the most value for you and your family, you look at, first, what will it cost me out of my pocket? So what will it cost me out of my payroll deduction? Or what will it cost me as an individual, an annual premium, to purchase that coverage for me and my family? So that's sort of the term premium. You also could hear it as employee contribution. That's that term. There is usually a deductible. It's usually an annual deductible, and that is a set dollar amount that has to be met, that you would pay out of your pocket before the plan benefits kick in. It could be $500, it could be $1,000. In some of the new consumer-driven plans, that deductible is even higher. It's in the several thousands. But the question, Lisa, is important because as you go to make a decision, you've got to look at both. You've got to look at, okay, what is the deductible or the coverage level of that particular plan? And then the second question is, what will that plan cost me, either as an employee contribution or as an annual premium as an individual? So we have some individuals who will just go to how much it costs me. And if you go to just how much it costs me, you're not making the most informed decision to protect your family, because that will be related to what the deductible and the coverage level is for that coverage. They go hand in hand when you're trying to create the best choice.
Let's also talk about some of the other terms you mentioned: co-pays, co-insurance, and out-of-pocket maximums, because they also relate to one another.
I'll start with copay. I think for consumers, we have to hear those terms as it's the part I owe, the copay, the co-insurance. So that's copay and co-insurance. And the question was out-of-pocket. It's the amount of, once I've spent out of my pocket as the consumer a certain dollar amount, then the co-insurance of my plan goes to 100%. Most plans have an 80% co-insurance, a 70%, a 60%. We're pretty familiar that things are covered at a percentage. Once I've spent a certain amount out of my pocket, that out of pocket then triggers that co-insurance to pay at 100%. So it is a protection for the consumer, so a given event doesn't financially devastate them or their family.
Ann offered an easy way to maximize our health coverage.
Lisa, when I think about women and women's choices, I think about 3 Ps. And when I talk to them, I put it in these terms. So I'll give you the 3 Ps. The first is plan. Really know what is covered under your insurance. The next P is prepare. So prepare is know where the nearest urgent care facility is. Know where the nearest hospital is. Know what pharmacy you would go to. And more importantly, have the number of that pharmacy handy, so when you go to a doctor and they need to call in a script, they can do it right there. The pharmacy number is there. And now, through the mobile applications that we give our consumers, you have it right in your hand, and the mobile app gives you incredible immediate access. That would be in the second, is prepare, plan, know what's covered, prepare, be ready. And the third is my favorite, and that's prevent. So with the Affordable Care Act, most preventive care services, particularly for women, are covered at 100%. And what that means, getting back to the terms we just spent time on, there is no copay, there is no deductible, there is no co-insurance. So there is nothing that a woman has to spend out of her pocket before she would be able to take advantage of a mammography or a preventive care screening.
She also reminds us that lifestyle choices play an integral role in maintaining our health and wealth.
75% of expenses are related to lifestyle choices. 75% of health care is related to a lifestyle choice. And then if there is a disease burden, it can be found sooner. And when you can intervene sooner, your outcomes are so much improved.
We also talked about how the new law deals with serious illness like heart disease or cancer.
Lisa, as a breast cancer survivor myself, your question is important. It's important to me personally, but it's important to our women. So one of the aspects of the Affordable Care Act is that there is no longer pre-existing conditions. So if someone has cancer or has kidney disease or has heart disease, as they apply for insurance, they can't be turned down for a medical condition that they have.
Can we just touch briefly on the Affordable Care Act and how we're really going to see it impacting women who are actually at a large employer or women who are purchasing insurance through the exchanges?
Whether you're making a selection for your insurance coverage through the employer, Lisa, or you're purchasing it on the exchange, you're really looking at the same things. You're looking at level of deductible, level of coinsurance, which we spent some time talking about, as well as how much am I paying out of my pocket, so the premium or the employee contribution for that coverage. And typically on the exchanges, you've got the metals, so you're hearing gold, silver, bronze. I'm sure that's familiar terms to many individuals who are on the exchange looking for coverage. The real difference is not what's covered under each of those metal plans. It's the difference between how much it costs and what the deductible is or the coinsurance.
And whatever our background, women share the same concerns when it comes to health care.
Their biggest concern, over 50% of women are worried that they're going to run out of money because they can't afford if a serious illness or injury impacts their family. The second aha was 72% of women in our survey said that their biggest health care concern for the future was taking care of elderly parents. Now, I've taken care of elderly parents for the better part of 15 years. And so understanding the pressure that places on women who are not only important purchasers of their own family, now they have the extended responsibility of their parents or their partners or spouses' parents, making the decisions that impact them financially and what that means, and then are they getting the best clinical care?
And thanks for being with us. You made it all very simple and clear.
My pleasure, Lisa, and it's a pleasure talking about women and women's health issues, and we hope that their choices are made simpler as they go through this important time.
So Caitlin, what did we learn today?
So what we saw was that most women actually are aware of some of the key changes that relate to them and the Affordable Care Act. We still found a lot of women that are still struggling with all the details.
That's really true.
So Lisa, how about you? What was key for you?
I really liked Ann's 3 Ps of plan, prepare, and prevent, but I thought the third was most important because under the new law, there are no outlays for copay or coinsurance for any of the essential screening services for women.
That's awesome. That's so important.
So get out there, go to the doctor, and stay healthy. And don't forget to follow Feminomics on Twitter, on Facebook, and please subscribe to our YouTube channel. Thanks so much.
Stay healthy. Bye.
Bye.
That's alright. She is on the money tonight.
Which Latina actress in Spike Lee's Do the Right Thing said, quote, "Trust you? The last time I trusted you, Mookie, I ended up with a son." D. Rosie Perez. Rosie Perez. Shoot, that movie was old though. It's probably way before your time.
Whenever they get health care insurance, if they are pregnant, that they're covered for a certain amount of things, and if they go out on maternity leave, that they're covered for a certain amount of things, and that isn't always the case. And that concerns me a lot because there's more moms and stuff working in a household where there are dads like staying at home. So when she's the sole provider and she's out and she has to stay home, then what does her insurance actually cover for her or her child that's being born? So.
On the money tonight.
See you next time, right here on Feminomics.